Imagine going in for a routine visit to your doctor and being told that you have cancer and that you need surgery right now or you could die. And because he's a doctor, you trust him and you have the surgery. Except you never had cancer, you didn't need the surgery, and the doctor knew this the entire time. This is a real case about a real doctor. This is a real case about a real doctor, and as a nurse, I want to walk you through exactly how he got away with it for almost 30 years and what should have been done to stop this sooner. So Dr. Perwaiz was an OB-GYN practicing in the state of Virginia since the 1980s. On the surface, he was a respected and well-known doctor, and even his own website said that his surgical skills were unparalleled. He convinced patients that they had cancer, and he used the word cancer specifically to terrify them into immediate compliance. He pressured women into hysterectomies and D&C procedures that they did not medically need. In some cases, these women came in for their routine or annual checkups and had procedures done on them without them fully understanding what was even going on. He falsified pregnant women's due dates so that he could induce labor on his own schedule. Not for medical necessity, but for his own convenience. He falsified patient records to make these procedures look medically justified on paper. Nurses who worked with him testified that they repeatedly complained about these practices, but they were ignored. The investigation began only after an FBI tip from a hospital employee in 2018, meaning this had been going on for years inside of a system with colleagues who knew that something was wrong. He was convicted on 52 counts related to defrauding insurers of millions of dollars related to these unnecessary procedures. So let's break down how a real surgery procedure is supposed to work. So here is what is supposed to happen before anyone picks up a scalpel for something like a hysterectomy. It's not a same-day decision based on one doctor's opinion. There's supposed to be imaging like an ultrasound or an MRI, and even labs, especially when cancer is being discussed. A tissue sample should be sent to pathology. Things like a hysterectomy or a mastectomy are irreversible surgeries. You cannot undo it, and this is why it is so important to get that second opinion. Dr. Perwaiz exploited the power gap in that room. When a patient hears the word cancer from someone with doctor in front of his name, the instinct is to act fast. He weaponized that instinct instead of going through the diagnostic process. And here's the part that matters the most for those of you watching this. The nurses in that building knew. They complained. So I want to be clear about one thing. None of his patients did anything wrong by trusting him. That is the foundation of a patient-doctor relationship, is trust. The failure is that he chose patients and moments where fear would override that instinct. That's not a mistake, that's strategy. So if you go to see your doctor and he tries to pressure you into immediate surgery, there are some things that you can do to protect yourself. Things like a hysterectomy or a mastectomy are irreversible surgeries. You have the right to a second opinion, and you also have the right to have test results explained to you in a manner that you can understand. Getting a second opinion is not an insult to your doctor. A doctor who resists you getting one is a red flag and not a sign of confidence. If a doctor is pushing you to have surgery without giving you time to think or ask questions, then you need to take a pause. Take a pause and ask, what happens if we take 2 weeks and then repeat this test? A legitimate diagnosis will hold up under that question. This isn't about making you afraid of doctors. The overwhelming majority of them are exactly who they say they are. It's about even inside a system with checks in place, those checks only work if people actually use them. Dr. Perwaiz got away with this for so long, partly because his patients didn't know that they could push back. If you enjoyed this video, go ahead and click on the video that is on your screen right now, and I will see you over there, and I will see you guys on the next one. Bye, y'all.